Good morning, everyone. This is Pastor Reverend Davies of MUSIGO, Senior Pastor in Huruma Tent of Prayer, Nairobi, Kenya. And with me is my spiritual daughter, who will introduce herself.
Good morning to you all. WESONGA Sylvia Knight, a student nurse and also a member of Huruma Tent of Prayer Church.
Entering clergy, I just thought that it was wise for us today to bring some stuff on healthcare, especially at this moment where the whole world is wrestling with COVID-19 thing, where everything is just in a mess and it's in a standstill. And I'm glad that my daughter is pursuing some medical training, and she's a gift to us. That's why I asked her today to share with us as a church and to share with our neighborhood community, and also we listen to these insights on how we can really control the spread of coronavirus amongst ourselves. And therefore, before we get into what we need to study, I think it's a new thing that has just come into play and people are wrestling with it. Some are resisting every guideline that the health institutions are trying to give us, or the WHO are trying to give us, because of the difference in our cultures. Some people think it's just too much for them to ask them to wash their hands, especially after every 20 seconds or so. Some people think it's quite tiring to them, and cultures are into play, and this one might cost us a lot of lives if we don't address this. I don't want to agree that we should bring culture into this. This is a new issue that needs a new way of approaching it. We may just, as a church, as we pray, and also we should embrace what our professionals, what our experts are trying to advise us or to lead us to walk through this journey at this toughest time of the world. And so I will give to Sylvia the space by just asking you this question first. Do you think our culture should be embraced beyond what the profession or the medics are trying to say to us? What do you think? What do you comment on the cultures? Being an African young lady who has been born in this place, what do you think we should do to address this thing?
As for me, what I would like to tell the community at large is that we should not put or allow the culture to overcome this issue as we are trying to fight it. The only thing I could urge the community at large is that we try to be flexible and accept what has come about. We do away with our cultures and try our best to do what the medicine health workers are telling us to do so. Yeah.
Well said, Sylvia. But this is what I think from the context of where we live, where our church is, in Huruma, in Dar es Salaam. Can you help us walk through this in terms of our social life, marketplaces, where we buy our foods, where we do every stuff, the kind of congestion and people just mingling carelessly and every stuff? I know it's hard, but what do you have to advise the women and men and children who walks around our roadsides just to buy some goods for them to use back at their home? What do you see or comment about that?
According to where we are, like our geographical area, we can't say that we are less because we are many. It's kind of a slum area somehow. So people are congested, and this may come out as a challenge to most of us or to some of us. So one thing I could urge our community as we are is just that we take it in a positive way. We try our best, like in those markets, we ensure that we have established those water cans everywhere so that each and every person may be able to access that water to wash their hands, and because at times sanitizers may become difficult for each and every vendor maybe to afford, but I'm sure the issues on about water and soap, it can be something that is affordable, whereby each vendor can try to put it aside so that each and every buyer who comes by, the first thing he or she does is to wash their hands before they continue with their businesses.
If I'm hearing you well, Sylvia, are you saying that time has come where our hygiene knowledge should improve, should up? Because we live from a context where foods are just prepared in open spaces and the dust is just flying everywhere, everything is just in a mess. Are you appealing us that we should just reconsider the way of our hygiene in our community so that these terrifying virus cannot catch up with us?
Yes, in my opinion, I could say yes, because despite the fact that we may be fighting the coronavirus, but in other way, also in a positive way, we'll be able to fight other diseases such as cholera, which come along due to poor hygiene. So, on my own opinion, I'm suggesting and supporting it that we try to come up with a new way of embracing our hygiene or doing something better on it.
All right, well said, my daughter. I think it's a noble thing. Members of the church Huruma Tendo Prayer and the community around Huruma and Madare, that we should do some work on the hygiene, on our lifestyles, and just try to listen to what our professional, our healthcare workers are trying to take us through. And therefore, let me allow Sylvia to take us. Okay, this is the time I want us to be very keen and follow up my daughter, who is also a professional in this field, to take us through which steps can we apply in our life just to make sure we control the spread of the virus so that we can heal back to our normals. Therefore, since Sylvia, the ball is in your court, lead us through which measures are there scientifically and medically that we can put in place so that we can get better.
Thank you. First, I would like to say that it has always been said that knowledge is power, and at times we do suffer because of our ignorance. So I'm going to take this time and this chance again to remind us of the few things that have been mentioned all the time all over the world as we have been fighting this coronavirus. The first thing that has been talked about is about the social distance, whereby you have been told to take at least 1.5 meter apart, just the way as we have done with my colleague here. Through this, we'll be able to avoid on getting some of these infections. And so the social distance will protect us such that you won't have that direct contact with any person, maybe he or she, if she's having that coronavirus. You'll be at safer compared to when you're so much closer to him. So I'd just like to urge that we try our best to maintain the social distance, 1.5 meter. Secondly, I'd like to talk about washing hands with running water and soap. Running water is usually efficient because when you wash your hands while the water is running, the bacteria and the viruses are going together with the water. And so each and every one of us, we should try. I know water is so much available to each and every homestead, at each and every place, that it's readily reachable, so anyone can afford it. So I just like us that anytime you go out, you wash your hands. When you come back, you wash your hands. You ensure that before you touch your face, you touch your nose, your mouth, your eyes, you make sure you have washed your hands before touching anywhere around your face. And you washing hands, there are some few steps which you are supposed to follow when washing your hands. First, you wet your hands you put on the soap. You start by scrubbing on your palm. You go to the other one. Then you come this way. On the back side of the hand, you go to the next one. You come in between your thumb and the fingers. And you go also to the other one. And then you go here at the wrist area. Then you wash your hands with running water such that you put your hands in a position whereby that water won't be able to come back, so that it won't be able to come back again with the bacteria. You put them in a position such that when the water is running, all the viruses and the bacteria are going down. Thirdly, I'd like also to talk about the sanitizers for those who are able and capable of affording the sanitizers. Each and every time, instead of using water, you can use your sanitizer. When you catch anywhere, you use sanitizer, because you never know which place or which object is contaminated. So you use your sanitizers for those who are able and capable of it. And I'm not saying that for those who are using water, they are not safer than those who are using sanitizers. All of us are safe, and this should not put a stigma to each and every one of us, whereby someone will be there asking herself, why am I not using the sanitizer? But use the available resources that you have so that you can keep yourself safe. The third thing I like to talk about are these masks, like the one I'm wearing, the face mask. The government has really tried to encourage each and every one of us to put on the mask. Despite the fact wearing the mask may become a little bit an economical challenge, but I know each and every one of us, if we can't afford those that are so expensive, there are these ones that someone is just making them, and I know at most they can charge at 50 bob. There are those even costing at 30 bob, 20 bob. So you can use that one as we wait on the way forward for the government to provide the mask for each and every one of us, which at times or at most may become also an issue. So as you wait for the government to come up with their own mask, you can take that step and just sacrifice a 50 bob and buy a mask for yourself, so that you may protect yourself from the dust. The last thing I like to talk are about the gloves, and this is the most crucial part, whereby most of them are using gloves, but they are using them in the wrong way. The main issue of wearing gloves is to prevent yourself from getting infection, and after doing so, you discard it. So if I want maybe to use or to wipe this place, I wear my gloves and then I discard them. But most of us have seen people wearing this glove. Someone is having this glove the whole day, and you know that is risk. In short, even you are carrying more bacteria and transmitting more viruses than you could have done with a bare hand. Because if you have this glove the whole day, you have catched here, you have gone to a matatu, you have touched there, you have done there, you have touched there. So it's like you are a carrier of these viruses. You are taking this infection from one place to another, from one person to another. So for those who are using these gloves, only use this glove for one specific procedure, you discard and take another one. And if you can't afford, just avoid using the gloves and just use the bare hands. And also for the process of removing the glove, for instance, if you have worn your glove in this way, how are you supposed to take it out so that you ensure you're protecting yourself and you're protecting the community at large? First, you have to fold your hand. Then using your finger, you insert the inside. You're not supposed to touch the outer area because it's already contaminated. So you take this way, you fold it, and then you discard. So for those who are using the gloves, that's how you're supposed to use them. I think that's all I have, and I know this has been mentioned to each and every one of us. I'm just emphasizing on all these steps so that we may take it as an obligation or a responsibility to each and every one of us to protect ourselves, to protect our loved ones, and protect our community. That's all.
All right, Sylvia, thank you very much for taking us through the processes and the measures that have been put in place. Folks, one of my concern is we've heard Sylvia talk about the face masks, the gloves, the sanitizers, it's quite unfortunate that we have to live with it, that it has just come on us with an economical demand. The cheapest face mask we can get here, we can get it at a $50 price. $50 price. And you know, like people living in slums where we're coming from, there are some people who live within a dollar, $1 a day. You see, now people are trying to compare these. How do I spend $50 to buy masks? And yet I live within $1 expenditure. And this is the challenge that I'm just appealing to whoever is listening to this program, which I call healthcare session to our people, for our people, from where we serve as clergy and as a church. Whoever is feeling like he can donate, because the government is doing some good work, but I assure you the government cannot provide each and every citizen with the masks. There will be a challenge. And what we cannot advise is that one can use the face mask today and preserve it for tomorrow and the other. That will be the complication of everything, because the government has already gazetted this. It's going to be criminal if you walked out of your house without a mask. And so, friends, folks, I'm appealing to us, that should you be somewhere where you can access enough gloves, as a church, as a room attendant prayer, we would love to help our people to just reach these materials that will help us to control the spread of this virus. And so I'm very grateful for this morning session of our healthcare. We shall be bringing it over and over every time and again, to a language that befits our people, to a language to where our people does not feel like we are fighting them, or we are just speaking something that is too high for them. We want our people to understand this. We shall do this in all our 40 plus native languages, so that our people can get the right information. Thank you very much for each and every one of us just taking this time to listen to us. I want to thank my daughter Sylvia Knight for sharing with us our understanding on what is happening. Until another day we meet again, God bless you. As a church, let's be determined to serve our people. Bye-bye.